All righty, welcome back to The Factor Uncensored. There's a big debate that's been going on for a while, the use of fluoride in water systems. My next guest has more information about that mineral and whether or not it's safe for you and your family. And joining us on The Factor Uncensored, we have Dr. Danish Ali from Archpoint Pain Institute. Dr. Ali, for many years growing up and even till today, many of us see the commercials where they're saying fluoride in toothpaste, good for you. But now we're hearing that fluoride is a problem. How?
Well, Isaiah, what happened is that many years ago, fluoride came out in tablets. Companies started forming these fluoride tablets where they were advertising it as dietary supplements, and people were taking that. And what we realized is that it has a lot more side effects and complications than just taking it via the toothpaste and mouthwash that we've been doing for years.
Mhm.
It affects, so what fluoride is fluoride helps to decrease your chances of bacterial issues that lead to cavities in your mouth. But when taken in a tablet format, it can mess with your gut's bacteria. We know that there's bacteria and there's good bacteria in your stomach, and that fluoride, when taken orally via tablets, via droplets, can cause issues with your GI system, and it can affect your thyroids and cause you to have thyroid issues. And there have been some studies that have linked lesser IQ to intake, a higher intake of fluoride. So now the FDA is going after and saying, listen, we never endorsed fluoride tablets. They came out as dietary supplements and were advertised as such. But what now they're going back after those companies and saying, listen, y'all got to stop producing this fluoride because it's causing more issues and more problems than the good that it's doing or that it came out for.
And there are many things out there, Dr. Ali, that are on the shelves that you can buy at stores, at pharmacies, and they're not approved by the FDA. Why did the FDA decide to take action with fluoride? Because there are many things that are not endorsed by the FDA.
That's correct, Isaiah. I think it's because of some of the research that's recently come out, lots of publications that show the more complications and more side effects than the good that they were initially, that the advertising for the companies were doing. Again, this was never endorsed by the FDA. Now, also, Isaiah, there is a push across the country here for different states that are now eliminating eliminated fluoride from the water systems from tap water. So Utah and even Florida now is banning and stopping fluoride in your water systems for that specific reason that it does cause all these other side effects potentially. But the fluoride will still remain in toothpaste and also in your mouthwashes. That is fine. That's okay for it to get rid of your bacteria in your teeth and enamel. But specifically, we're talking about ingesting or drinking or even swallowing fluoride tablets.
Now, when it comes to fluoride tablets and fluoride in water, we're way down the road now. Do you think there are people who may have been impacted and just don't know?
Possibly, Isaiah. Yeah, I mean, that is definitely something you want to talk to your primary care doctor about. That maybe, especially if you've been ingesting or taking oral forms of fluoride. I don't want people to get alarmed here. The amount of fluoride that goes in the water is very minimal. And so it's below the recommendations as well. So it's very little that goes in the water system, but this is to raise questions for those folks that have maybe consuming oral forms of fluoride via tablets or droplets that may be affecting their gut flora, their thyroid, and other organ systems.
And if you believe you have been affected by fluoride in water or in the tablet form, but you don't see any obvious signs, where should you go to get checked out, or do you need to get checked out? Do you go
Yeah.
to an internist, your primary care physician? Who?
Yeah, you go to your primary care doctor. There are different tests that they can do. There are things that they can do, ask you some specific questions as well. So, yes, there are things you can do. And again, this is specifically for folks who may have been consuming fluoride in tablet forms excessively or regularly. This is not just everybody who's been drinking regular tap water.
Good information, what we need to know. And of course, we'll continue to follow this because, like you said, it's been in circulation for quite some time already, and we don't know the impact it's already had on people around the country. Dr. Danish Ali, Archpoint Pain Institute, thank you for joining us here on The Factor Uncensored.
Thanks, Isaiah.